Hello there, my name is Richard McMunn from the interview training website, passmyinterview.com, and in this important presentation, I will teach you how to answer interview questions that are focused on the 6 C's of nursing. So if you are applying for any nursing position or healthcare role with any hospital, NHS trust, or medical organisation, make sure you stay tuned because I promise to help you pass your interview at the first attempt. And to achieve that goal, this is what I will cover in this training video. Number 1. So I will explain what the 6 C's of nursing are and why they are so important to the role of a nurse or healthcare professional. Number 2. I will then tell you which interview questions I recommend you prepare for that will focus on the 6 C's of nursing. Number 3, I am then going to give you a unique top scoring answer to each of those 6 C's of nursing interview questions to help you pass your interview at the first attempt. And then finally, number 4, I will tell you where you can instantly download these slides plus my 25 brilliant answers to tough nurse interview questions. And just very quickly, if you are new to my YouTube channel, please make sure you hit that subscribe button. I am here to help you progress throughout your career. I can only do that if you are subscribed. And please give the video a like because that really does motivate me to create more content for you. Thank you very much indeed. Okay, so the first 6 C's of nursing interview question I recommend you prepare for is, what are the 6 C's of nursing and what do they mean? Now, to help you answer this first interview question, I am going to give you 2 important tips and I will then give you a top scoring example answer. So, tip number 1, before your nursing interview, make sure you learn the 6 C's of nursing and how they specifically apply to your work as a nurse or healthcare professional. And also, an important note, you will get asked questions about your knowledge of the 6 C's in your interview, so make sure you are prepared for this type of question. And tip number 2, in your answer, say what the 6 C's of nursing are and then briefly explain how they apply to your daily work. And I also recommend you refer to the 6 C's as values because that is exactly what they are. So here is my top scoring example answer to help you pass your interview. What are the 6 C's of nursing and what do they mean? Here we go. The 6 C's of nursing are a set of important values that all nursing and healthcare staff must implement in their daily work to provide first-class treatment and care. The 6 C's are care, compassion, competence, communication, courage, and commitment. Care is the core business of nursing and it ensures the work we do helps patients and improves the entire community we are there to serve. Compassion is delivering care through positive relationships built on empathy, understanding, trust, and dignity. Competence is about having the necessary qualifications, training, and clinical and technical expertise to do your work effectively. Communication is central to caring relationships, but it also includes listening and making sure the right decisions are always made. Courage is about doing the right thing and also speaking up when you think something is not right. And finally, commitment is being dedicated to being the best you can be as a nurse and being focused on continuous improvement so the care provided always meets the needs of patients. So that is a brilliant model answer to that first of our 6 C's of nursing interview questions. What are the 6 C's of nursing and what do they mean? Now you can either pause this video if you want to and write down the questions and answers as we work through them together, or if you want to wait, I will soon tell you where you can download these slides with the tips and answers, plus an additional 25 brilliant answers to difficult nursing interview questions in a PDF guide. Here is the second of our 6 C's of nursing interview questions. Which of the 6 C's do you consider the most important? This is a really difficult question to answer because which of the 6 C's do you choose? Well, let me help you. Tip number 1. So this is a common nursing and healthcare interview question, but it is not easy to answer. All of the 6 C's are just as important as each other, but you must choose one in your answer. And tip number 2, I recommend saying that competence is the most important of the 6 C's before you then explain why you believe that to be the case. So let me now give you my example answer that chooses competence as the most important of our 6 C's of nursing. Here we go. Which of the 6 C's do you consider the most important? Every one of the 6 C's is as important as the other, and without all of them, effective treatment and care could not be provided. However, if I had to choose one, it would be competence. Without competence, nurses and healthcare staff would not be able to provide the correct levels of care, demonstrate compassion while dealing with patients, communicate effectively, have courage, or be committed to continuous improvement and progression. So that's a really good model answer and of a scripted response you can use to help you prepare for your nurse or healthcare professional interview. Now, please don't go anywhere because I still have more questions and answers to work through with you. But when you're ready, click that link in the top right-hand corner of the video. Head straight through to my website, passmyinterview.com, and you can download my full set of 25 brilliant answers to difficult nurse interview questions. And you also get these exact slides as a free bonus. Here is the next question I recommend you prepare for that is focused on the 6 C's of nursing. And that question is, tell me about a time when you demonstrated courage as a nurse. Here are 2 tips. So tip number 1, courage is one of the 6 C's of nursing, and as a nurse, you will have demonstrated courage many times in your work. Tip number 2, courage means speaking up when you think things aren't right and also embracing change and trying new working practices to ensure patients receive the best outcomes possible. So here is my top scoring example answer to help you pass your interview. Here we go. Tell me about a time when you demonstrated courage as a nurse. Courage is one of the 6 C's of nursing, and it involves having the courage to speak up when things are not right and to also embrace change and new ways of working. In my last position as a nurse, a new charge nurse took over the running of our ward. The ward was very effective and we had a great team who worked really well together. However, the charge nurse wanted to make some changes to how we operated, including some additional practices relating to hygiene procedures. Now, some people in the team said the changes were unnecessary, but I told them it was important for us to support the charge nurse and try out the new methods of working, as this would ensure we progressed as a team. After the new working practices were implemented, the effectiveness of the team and the level of care provided greatly improved. So that is a really good example situation that somebody has been in where they have demonstrated courage, one of the 6 C's of nursing, in the workplace. Let's move on to our next interview question that is focused on one of the 6 C's of nursing, and that is, tell me about a time when you used effective communication to improve patient outcomes. Here are 2 really good tips. Tip number 1, so communication is, as you know, another important value that forms part of our 6 C's of nursing. Now, this common behavioural interview question assesses your ability to communicate in a style that meets the needs of your patients. And tip number 2, talk about a situation where you met the needs of a patient and provided first-class treatment or care. So here is another brilliant example answer to help you pass your nursing interview. Tell me about a time when you used effective communication to improve patient outcomes. I was assessing a patient who was showing early signs of dementia. The patient had a relative with them, so I needed to choose a style of communication that applied to both of them. Throughout my communication with the patient, I spoke slowly and clearly and used sentences that were easy to understand. I maintained eye contact and allowed them to ask many questions. While talking to the relative, I encouraged the patient to be involved in the discussions and ensured that I gave them time to speak. It was my duty to create an environment where the patient did not feel rushed or pressured. I also let the patient speak for themselves, and when the relative tried to talk on their behalf, I respectfully asked that they allowed the patient to speak. Now, although this type of situation takes longer, it is important to take your time and change your communication style to meet the patient's needs. So that's a really good example situation that tackles that difficult interview question with confidence. Let's move on to the next question, and that is: commitment during difficult situations is one of the 6 C's of nursing. Describe a time when you responded positively to a challenging medical situation. This is a difficult question to answer, but before I give you my top scoring example response, here are 2 important tips. Tip number 1. So again, this is another common behavioral interview question that is assessing your experience and competence as a nurse. Tip number 2. Give a situation when you remained calm and created a solution to a challenging situation that ensured excellent treatment and care was delivered. Here is another fantastic answer to help you pass your interview. Commitment during difficult situations is one of the 6 C's of nursing. Describe a time when you responded positively to a challenging medical situation. Last winter, our services were under extreme pressure at the hospital I was working in. In addition to the winter months' increase in hospital admissions, we were hit by higher than usual staff sickness, resulting in locum nurses having to come in and help out. Now, because the locum nurses were relatively inexperienced and unfamiliar with the surroundings and our working practices at the hospital, this compounded the pressure we were all under. To manage the stress and pressure of the shifts, we assessed the skill level of the locum nurses and assigned them specific tasks that we knew they could perform to a competent and high standard. The remainder of the healthcare team, me included, cared for those patients who needed more care and attention. By utilising this approach and conducting regular patient needs assessments throughout each shift, we collectively manage the situation while maintaining high standards of treatment and care. So that's a really good answer, and you can see how all of these responses are going to help you pass your interview and tackle those difficult 6 C's of nursing interview questions. So the next thing to do is to make sure you click that link right now in the top right hand corner of the video. Head straight through to my website, passmyinterview.com, and you can download these slides plus my full set of 25 brilliant example answers to tough nurse interview questions. It comes in a PDF guide, which means you can have all of the resources literally within 2 minutes from now. Make sure you check out that link. Also, don't forget to hit the like button. That really does motivate me to create more content for you. It's a small ask, but I really do appreciate you supporting my channel. Don't forget to hit that subscribe button. I can help you throughout your career. And you can also, if you want to, connect with me on LinkedIn. I have put my LinkedIn link in the description below the video. It is always a pleasure to connect with like-minded professionals such as yourself. Thank you for watching, and I wish you all the best for passing your nurse interview. Have a wonderful day.